everybody. Welcome to another fascinating episode of Here's Why You're Wrong. I'm Mick. This is Jim.
Hi.
We've got Mike in the booth over there.
Hello.
And this is Here's Why You're Wrong, the discussion show where we're always right and you're always wrong.
That's right.
It's actually a great premise for a show. So, how are you, Jim?
I'm fine.
Yeah.
I'm fine, Mick. How are you?
I'm doing fine.
Did you have a good holiday? Were you off yesterday?
I was.
Yeah, I was on call for healthcare all weekend. Yeah, I had a very busy weekend.
Funny you should mention that, Jim.
Yeah.
You know,
Is that tonight's
I
topic?
had a little bit of a cough myself, which made me think about healthcare. Yeah, that is tonight's topic, actually. And so we want to talk about healthcare tonight, and that's a sort of a global issue. But there's a couple of very definite points I think we want to hit. We've done a little bit of research. I want to talk about some things here. If you would like to join the discussion and you're listening live here, you can give us a call, 503-207-7135. Hit us up at the website, WrongTvShow.com, and we'd love to hear from you. I'd like to start with a philosophical question, if I may, Jim.
Mm-hmm.
Is healthcare a right? Is it a basic
Or
human
a privilege?
a human right? And I'm not advocating
Right.
one side or the other on this, but there are lots of people who say it's a right, and I think we have a right to question that. Do you think that it's a...
I think it's a right. I think it's any civilized society. Just practically, if your neighbor down the street has a communicable disease and can't afford to go to the doctor and get treated for it, it might infect my family or other families on the street, so such as tuberculosis. So yeah, there is a definite need to have health care for everyone, and in my mind, it's a right as well as a privilege that we live in a country where that is possible.
Okay, so let's take that a step further then. You think that hospitals and, I mean, we've gotten to the point today where we have some pretty advanced medical, devices and surgeries, and I mean, our medical knowledge, just even from 10 years ago, is leaps and bounds ahead of where it used to be. So what do human beings have a right to? I mean, does somebody living in a third world country have the same rights to a new lung that you or I have? I mean, how far do you take this? I mean, everybody has the right to maybe vaccinations or, some sort of what we would consider basic
Yeah, there's a
caretaking.
basic level of health care that everyone should have access to.
Okay. And when you say everyone, you mean across the globe?
Eventually, yeah.
So who foots the bill for that?
Well, that brings us back to the question of taxes, corporate taxes, individual taxes, and the commons, the areas that we all use in society: fire, police, military, healthcare. There is a common area that the roads, the bridges, the airports are all common areas that we all use. The infrastructure in this country, just talking about the United States, and this has come up with Apple recently, offshoring, what is it, $74 billion worth of profits that they did not pay taxes on, and yet they used the infrastructure of the United States and the peace that we have here, and serenity, and the highways and the bridges to make their products and market them here, and yet a large portion of their profit they sent overseas and did not pay taxes on it. So
yeah, but that's a little bit of a stretch, making the connection from corporate taxes to healthcare. I mean, you're asserting that globally taxes should be used for the greater good, not just healthcare, but streets and firemen and all that stuff. But I mean, to say that GE Corporation should pay for my kidney transplant is a little bit of a stretch, because they could rightly say, well, what I've got nothing to do with your kidneys and what,
Well, yeah, but you're talking about is healthcare a right? So if it's a right, it has to be paid for.
hmm
So that's going to be paid for by the people that use it and the corporations that are profiting off of it. With the Affordable Care Act, for instance, we did not get a single payer healthcare system. We have uh, multiple insurance companies um, making profit off the providing health care to people. We'll see how that works out.
Well, when you talk about who should pay for it, I think a logical source is the people in one way or another, rather than corporations. Frankly, I mean, I think corporations and their tax burden and what they should be paying in is a whole other discussion, and a big one. And I absolutely agree with you that they should be paying their fair share. But healthcare is a very human sort of thing. I mean, it's very primal, and it's sort of
But
the
corporations are people,
I,
my
I
friend.
knew I knew you were going to say that the minute I opened my mouth with that. But um, so I mean, maybe it's paid for out of payroll for those employees.
Well, we
That's a
are. I
closer
mean, I
step.
pay for my family of four. I pay. What do I pay? I pay $187 every 2 weeks to get what, in my mind, compared to the health care that I got working for my companies even 10 years ago, probably I get 30% less health care for and pay 50% more. I don't mind paying the taxes, and I've been lucky. I have a job and I can afford to pay those premiums, and my family has health care. Things that would be covered at a very minimal amount of money now cost me hundreds, if not thousands of dollars a year.
hmm
Um, that 10 years ago would have cost me a small copay. So I can understand if we're going to pay for health care for everyone that um, I'm going to have to pay a little more. I have no problem with that, but I do want to see GE, Apple Corporation. Um, I think is it 1 in 5, statistics, 1 in 5 or 2 in 5 no, actually, I think it's 4 out of 5 corporations do not pay taxes in this country anymore for one reason or another. Um, if you are using the infrastructure of the country and its peaceful conditions to make a profit, you need to be paying your fair share. And I come back to that because healthcare is expensive, and you can see in just in Oregon here, in these counties in southern Oregon and now Columbia County tonight, they cannot afford to pay for public safety because the tax base has been so eroded. Um, and healthcare is a big part of that.
Well, so when you're talking about infrastructure, you're sort of making the people the infrastructure in that statement. I mean, you're saying if these corporations are going to use our people, then they should pay for our kidneys, right? I mean, is that
Well, a basic level of healthcare, there's going to have to be choices made. No, you can't have every of the 350 million people in the country having the maximum advanced healthcare possible in the world. That I don't think is financially possible. There has to be
a base level is
a
what you're
base
talking about?
level of care, immunizations, um, prenatal care,
hmm
um, drug and alcohol, since that is an epidemic. It continues to be a big problem because people want to medicate themselves against the reality of working for a job. But, um, you know, drug and alcohol treatment, you know, being able to go into a hospital for an operation and not going broke or declaring bankruptcy um, because of that. Uh, there's the uh, they've categorized all diseases and entities, and the ICD-9 code system is one way they do that. You have to go through that ICD-9 list and okay, this one, this one, this one are going to be covered for the basic national health care, not this one. Um, you know, Dr. Darm's liposuction is not going to be covered under the Affordable Care Act. I'm sorry, but
That is bad news.
yeah, I know. For me, I was hoping I could get an eye lift or something, but
Don't go to him. Go to somebody else.
yeah. Anyway,
Well, okay.
I kind of agree with him though. They are kind of combined. The fact that corporations are avoiding paying these billions and billions of dollars in taxes, don't you think, Mick, that does have a direct correlation to healthcare? That if we just, bottom line, if we had more money, that would help more Americans, if we're just talking about the U.S.?
I think there's a link. I wouldn't call it a direct link. I think there's a general link to the world would be a better place and this country would be better if everyone paid their fair share. I don't think that corporations are any more responsible for our health care than they are for our streets and you know, like I said,
do their
our firemen.
trucks use? Does Apple use the FedEx to deliver their iPhones to the millions of people in this country?
Sure.
Okay, the bridges, the roads, the you know,
The health of the drivers.
right.
Well, okay, so let me ask a bigger question then. What about the corporations in America and the structure of our vacations and our holidays compared to the rest of the world? Does you think that has a negative impact on the workforce here? I mean, we have some of the lowest vacation days. You know, I mean, there's places like Sweden and you know, where they get, and Europe too. I mean, they get, you know, 2 months off every year, and they encourage their employees to take that much more than we do in the U.S. And I think that probably lowers stress, blood pressure. I mean, I'm sure there's a whole bunch of different areas that affects, and we don't have a culture around that here. I mean, it is supposed to be, you know, get up at 8, get home at 6, and that's it. And I think that probably has a negative impact on people. That's one of the biggest factors I think corporations have to do with healthcare, rather than whether they pay or not. I think just our society.
But I think adults, in that case, it's their decision to go out and buy a brand new iPhone when they can, you know, or to have a huge house that they don't need the room.
Right.
Yeah.
It's kind of the American, you know, dream, and the. But I think that's changing a little bit. I think people are downsizing. They're forced to.
Hmm.
Um,
I agree. They're forced to. So,
Don't you guys still agree that the standard of living in the U.S. is pretty good? As bad as it might seem, I mean,
Oh, yeah.
relatively.
No, I think the standard of living in the U.S. is too good, and that's why nobody cares anymore, because we're all too comfortable. So I think that's definitely an issue. But I mean, only in America is our problem that we're too fat. You know, like we're too comfortable. There's too
Right,
much
you
food on every corner, and it's so dirt cheap. Poor us.
right.
You know, you can't go to Africa
You don't have
and
any
say that. You know?
any lactose intolerant Somalis, I don't think. So
Probably
yeah.
not. No, and that breeds a whole, you know, a whole other aspect of, you know, people with more allergies than ever
Chronic
before.
diseases that are costing the healthcare system because people don't take care of them. I think that's a very good point.
I mean, these are first world problems.
Yeah, you know, the what are those movies? Super Size Me.
Yeah. Which other? Well, there's the Michael Moore.
Sugar, Fat, and Salt. There's another movie called that, or something like that.
I try to stay away from those because they make me feel guilty. Because I eat garbage. But anyways, let's talk about some numbers for a minute here. So the WHO, World Health Organization rankings. The U.S. is number 37, and this is from, I think, 2012.
For life expectancy.
No, in terms of health systems.
Okay.
Overall, I do have a life expectancy, some numbers here, but so we are 37th. Do you know who's first, Jim? Who would you think would be the best health system in the world compared, according to the WHO? Because I was wrong.
I don't know. Switzerland?
That's what I would have thought, somewhere over there. But
Yeah.
It's not. It is France.
France. Okay, close.
Were
Yeah.
you surprised by that, or you're not surprised by that?
So it's better in terms of what?
In terms of cost per capita,
Oh, okay. To provide health care to their population, the
right?
cost is reasonable, and
There's
they have a very vocal public that when things, you know, do not, they don't like the way things are going, they get out in the street and they protest, unlike here, yeah. Um, so, yeah, I mean,
So how much money, Jim? Do you know how much money would the corporate, if corporations paid their fair share of taxes, would our health care improve substantially?
I mean, that's a pretty broad question. Yeah, if corporations, you know, again, statistics, I don't know, 30 years ago, corporations paid 25% of, this is what I've read, of the revenue to the United States Treasury. Today, it's somewhere in the neighborhood of 8%. Individuals, you know, have then picked up the slack, and keep more and more keeps being put on individuals. Um, and you know, it's been in the news constantly. The income inequality in the country is just out of control, where 400 families own more wealth than the bottom 50 million people. That is a recipe for disaster.
Well,
Um,
let's
I
look at
don't know. That's a separate discussion. Talking about capitalism, I mean, is there
yeah.
a
That's
better? That's a completely
well,
separate.
I'm
it's
just
one
saying.
of Jim's
I'm
favorite
saying.
topics.
I'm okay. I'm just saying that the
If they
commons.
earned it, then
Okay, the
we can
commons.
keep it.
Healthcare is part of the commons. The roads, the bridges, healthcare, police, fire, um, air traffic control, all part of the commons that we all use. That that allows commerce to happen. That allows us to have jobs. That allows me to go and get in my car and drive on the freeway over the bridges that are maintained, that hopefully haven't fallen into the Skagit River because of not being maintained. Again, there's another whole subject. Um, those commons have to be paid for by someone or some entity, and I do not mind paying my taxes. Okay, I I I want to be a basic level of health care, a basic level of road maintenance and police. I want to be able to call 911 and have the police respond. Um, but getting back to health care, um, what is it? 50 million people have not had health care, and now the Affordable Care Act is going to allow those people to theoretically
Let's talk
obtain
about
health
the
care.
affordable. Let's talk about what has been dubbed Obamacare. Okay, for better or for worse, and the right wing has meant that as in a sort of pejorative way to make it insulting, because they think it's going to be a bad plan overall, and I think that the Obama administration has sort of grasped onto that and said, fine, you want to call it Obamacare? We'll call it Obamacare, because when it's awesome, then our name will be attached to it, and then, so suck it, Republicans.
Right, it's like the drone program. They call that Obamacare too.
Well,
Sorry. Okay.
well, again, separate discussion, Jim. But here's the problem with Obamacare, and I hate even calling it that, but it's the
The
fastest way.
Affordable Care Act. Okay.
I know, but that's too long. I'm sticking with Obamacare.
The ACA.
The ACA. Here's the problem with the ACA. Nobody knows what the heck is in it anymore. And it got so watered down, it went through so many changes, finally got approved, and there are so many rumors out there about, there were rumors on anything from death panels to this to that, and it was all just crap.
Right.
But the final product that went through is difficult to understand if you've taken a look at it. And more importantly, the Obama administration has not done a very good job of clarifying what's in it. So that's, the Republicans have tried to repeal this act 36 times. 36 times. And, the Supreme Court has come in and said, nope, it's legal. You would think they could put the thing to bed at that point, but no. They just keep coming back and back and back, and they refuse to move on from anything else. Meanwhile, we don't know what it means. We keep hearing that, boy, when this thing goes into effect, it's going to be a huge pain in the butt. Things are going to grind to a halt. I don't know what that means. What does it mean for me? I have insurance through my employer. I pay privately for my
Okay.
family.
Yeah.
So
What's your
is there an impact on me?
premium?
$350 a month.
And what's your deductible per person
Oh.
in your family?
2,500
Per
person.
per person.
Per person. I mean, it's basically catastrophic at this point. I mean,
That means you have a family of 5?
well, I think it maxes out at 7,500.
Okay, so your total maximum out of pocket is,
Mm.
and
Well, and that's the other thing. So there's a deductible, and then
Right.
there's a maximum out of pocket.
Right.
Which are two different things.
yeah, so if one person, gets really sick and then you don't have to get the 2,500 for each of the 5 times 2,500.
I suppose not.
Yeah.
Yeah. But I mean, that's part.
Mike, do you have health care?
I don't have a comment on that.
Okay.
I'm an entrepreneur. What does that mean?
That's a no.
All right.
Okay. So Mike's the one who's sitting in the emergency room at 3 in the afternoon on a Saturday because he has a cold, and
Right.
costing you and I
I don't trust doctors anyways.
thousands. Oh, okay. Mike's at the naturopath getting acupuncture.
I can tell you what,
Ancient Chinese secret.
in my job, if you have COPD and you need home oxygen,
Mm-hmm. Well, so
Beef-
let's give some clarification on your background here because people don't know. So
okay.
you do
Well,
respiratory
I'm a respiratory
therapy.
therapist. I'm a clinical liaison. I discharge people from the local hospitals. I do a lot of oxygen. The Medicare allowable for home oxygen service, which is a concentrator machine that runs on electricity and makes oxygen, and a portable system that goes with that you use when you leave the house. Before this July 1st, the Medicare allowable for that is $177 for the stationary unit and $30 to $50 for the portable unit, depending on what system you get. After July 1st this year, that cost goes to $93
So is that per month or what is
per
that?
month.
Okay.
Per month. So we are essentially having our reimbursement cut by 43% for that service. So
what's
you have
the actual cost? Well, you probably don't know this, but what's the cost?
the
to
cost
the
of
company
delivering
providing
that service. You have me going into a hospital, collecting information, faxing it to my office, calling my office and arranging for the delivery of the equipment when the patient gets home. The technician drives a large truck out to wherever. We have a service area that encompasses down to Albany in the south, up the gorge to Cascade Locks, out
So
to
you're
the
way
coast.
over $100 already.
Already.
Without the cost
Already.
of the physical
Right.
thing.
So if the patient only gets a 1 month of service, we lost money. Okay. Even at the current rate, it's difficult to make. So this is the nature of the poor for-profit healthcare system. We are being hammered because the physicians, being a stronger lobbying group, have been able to stall out any cuts to their reimbursement. But we're kind of the weakest player in the home medical equipment industry, is kind of the weakest player and one of the weakest players in the whole thing.
Well, but you have an interesting view on things in that you are out in the field with people who have just recently gotten out of the hospital or have some ailment and they're stuck at home. But you are, you're you're out in the field,
Right.
visiting with these people, seeing their living conditions, and probably.
I'm seeing them in the hospital.
Okay.
Yeah. I've gone into the home for many years as well.
You've done the
but,
home visits
yeah.
and all that stuff, so you've seen what people are living like, and you're probably aware of who their insurer is or how many of them are on Medicare, Medicaid, and
Yeah.
that type of thing.
Yeah, there are certain insurance companies that are disgusting the way they treat people. I could name them, probably wouldn't be a good idea, so I won't.
Well, that brings me to my next
Okay.
next question then, and let me just remind folks that phone number is 503-207-7135 if you want to call in, and check out the website WrongTvShow.com. Send us some comments there. So aside from how we're going to pay for all this stuff, there's the subject of just costs in general, skyrocketing over the last 10, 20
Mhm.
years. Nobody is willing to take the blame for this. I mean, that doctors say, it's the insurance companies gouging everybody. Insurance companies say it's the hospitals. Hospitals say it's the doctors and the insurance companies. What?
It's a combination of things. It's the cost of the technology that to create the technology to treat medical issues.
Mm-hmm.
That is a definite cost. Um, it's insurance companies, because they need to make a profit, and they have overhead, they have administrative costs, and there's 500 plus insurance companies in this country, all have their own overhead with administrative costs, all have to make a profit. So you're adding 25 to 30% for these insurance companies, um, to make a profit and be a for-profit entity.
Well,
Um,
so you're blaming it on the insurance company.
well, then there are drug companies. When Bush signed Medicare Part D, the drug benefit for Medicare, he forbid the federal government from negotiating for drug prices because of the strength of the drug and pharmaceutical industry lobby in Washington. It's the same thing with the Affordable Care Act. The subject of a single payer never even came up. Max Baucus, the leading Democrat senator, would not allow that topic to come up when they were discussing the Affordable Care Act.
Right.
Medicare has an overhead of 2 to 3% compared to an insurance company that has an overhead of 25 to 30%. So,
Why does an Advil at the hospital cost me $45?
um, because I don't know.
I mean, an overnight hospital, I understand to some
Okay,
extent
here,
nursing and somebody has to come in and check on you, but one night at the hospital is like $1,000.
well, they just had that whole article recently. Part of the Affordable Care Act is making healthcare more transparent. They just came out with that news article in the paper. The same procedure, I think it was stents in the coronary arteries,
Mm.
placement of stents in coronary arteries. In the Miami area, they measured, I think it was 5 hospitals. There was one hospital charged over $100,000 for that procedure, another one $30,000. So part of the Affordable Care Act is the more transparency in that.
Well, I think that's a key word in how healthcare works. I mean, I've never seen an industry even remotely like healthcare in the lack of information you can get for a simple service.
And how confusing it is, yeah.
It's unbelievable. I mean,
Yeah.
and I've had this many times. I've had medical procedures done, or I've had to, call around, and I had to have nasal surgery a couple of years ago.
Yeah.
And so you say, okay, well, geez, I gotta know how much this is going to cost
Did
me.
that help?
Not really. But
It was supposed to help you breathe better through.
yeah, it was for sleep apnea and
Okay.
helping me breathe better. But I said, okay, well, I have insurance, but I don't know how much
Did
this
it
is going to
hurt?
cost. Didn't feel great.
Okay.
But, so I call him, I say, well, how much is this going to cost me? Well, the hospital will tell you how much the stay is going to cost you for one
Right.
day. But I'm not going to tell you how much the anesthesiologist is. That's a separate bill. And I'm not
Right.
going to tell you how much the surgeon is. That's a separate bill. And I'm not going to tell you what your insurance is going to cover. I can
Right.
only tell you what the plan says it covers. So you end up making 4 different phone calls, trying to get the totals, then multiplying them by whatever percentage you think your insurance is, to try to come up with, okay, out of pocket, this is going to be $3,500.
Mhm.
If I need to have my car worked on, and I call and the mechanic says, well, I can tell you what Bob's going to charge you for the for the spark plugs. I can't tell you what Pete's going to charge to lift the motor out. You're going to have to call him. And then AAA is going to pay a percentage, but I can't tell you what the percentage is. You'd have to call them and give them this code, and then they can tell you what the
Right.
percentage is. There's no way. There's just no way. I would say, no, never mind. I'm not getting my car work done by you. Every other industry, you say, how much do you charge for a tune-up? $164. Great. How much do you charge? $183. Well, I'll go to the $164 one. The medical industry is not like that at all. You cannot call around and find out what people charge because it's such a thick coating of red tape to get.
Yeah, it's kind of like trading stocks. I mean, going to TD Ameritrade or T. Rowe Price or whatever, or buying a mutual fund and trying to understand what the expense ratio is. It's very similar to that. The less information you have, the more obfuscation the company can make. The, People just throw up their
We have
hands.
Philip from Beaverton, Oregon.
Philip. Okay. Is he on the air now, theoretically?
Yeah, I can hear you.
Oh, okay. Can we turn him up a little bit in here? Because I can't hear him very well, Mike. You may need to get Christo to do that.
Can you hear him?
Can you hear me now?
Oh, there you are. Now I can hear you better.
Hi,
Okay,
Philip.
Hey, how are you?
Good. How are you?
Good. So I just heard a little bit about what you guys were talking about. I know you guys are getting into the details on the cost of Obamacare. Well, the main problem I've always had with Obamacare from the very beginning was simply that when Obama ran, was in the first election, he was running based on that we would all have the same health care coverage as the federal government. And from what I could see, he never even tried to pass a bill that was similar to their cushy health care plan. And I have a big distrust in any politician that does something like that.
Yeah, that's a good point, Philip. So I mean, so what you're talking about is, hey, if this healthcare is so great, why don't you guys use it?
Absolutely.
Yeah.
Absolutely. But it wasn't just that. Why don't they use it? I have a problem with a politician who says that they're going to push something that is just as good for government as it is for the people, or vice versa, and then doesn't even try to push the legislation. And that's what I found with Obama. It's one thing if he just said that this was Obamacare and didn't even mention that he wanted us to have the same kind of health care coverage that the federal government has. But for him to say he wants us to have the same kind of coverage that the federal government has and doesn't even try to deliver on that.
Yeah.
I distrust the politicians that do that.
Didn't he try to deliver? But I mean, it takes Congress to agree to that or to do something about it, and they refuse to do that.
I never saw anything, and I followed this when he was going through it. I never saw anything that even resembled
You
what
may
the
be
federal
right.
government.
Oh, that's right. Here's why you're wrong.
You may.
Okay.
Yeah, I feel like because of the title of the show, we have to disagree with Philip in some way. But no, he's right. I mean, absolutely. And if you implemented a single payer system of some kind, it should absolutely apply to Congress and everybody.
Yeah, it should. Yeah, there should be a basic level of health care that you have to pay for at some level. And, wealthy people will always be able to afford whatever health care they want to buy. But there needs to be a basic level of health care for all citizens from birth till death. That's my point. But Philip, you have a good point. The same health care system for us should be for Congress.
If you think that you're going to get politicians to do something that's not in their own best interests, and just adopt something to make us feel better. I mean, there's no way. There's no way. There's maybe 2 or 3 people in Washington who would do that, and the other 600 think they're crazy. So,
well, the problem is we reelect people. We've come to accept elitism in this country, and that goes with both parties. And
I agree.
And it's not just the healthcare. I mean, we could get into Social Security, the fact that they have their own cushy retirement system, but yet they force. How are they supposed to fix something when they have no vested interest? And there's an elitist attitude that I think is really taken over. And what's even worse about the elitist attitude is that we've come to accept it as a country.
Well, and that's the big problem.
Live a different standard.
And that's way beyond healthcare. This is a problem with many things in this country. Is that there's only the only people who can make a change are the people of this country. Every problem we have that goes into politics or healthcare, any of these areas, these are all people that we elected to be there, and we sit down and we re-elect these people 6 or 7 times in a row, and then we sit here and we complain that something hasn't changed.
Well, you're going to do the term limits again.
I am. I mean, I'm not going to get too deep into it, but I mean, part of it is our fault.
Yeah.
Not me and you and not Philip, but this country, we sit on the sidelines. We have sort of said, well, what are you going to do? It's politics. And that's such a crap attitude that, you know what, it's never going to change if we do that. And, you know, when Philip's talking about forcing people in Washington to do something that they don't want to do, or getting them to even just live up to their promises, the only way we have to ensure that happens is to not vote them in if they don't. That's
Right.
the only recourse we have. Once they're in, they're in. And we need to say, okay, you know what? I don't like what you did. I don't like this healthcare thing. I don't like that you are two-faced. I'm voting you out.
Yeah, but what's the alternative? One other person on the other side? We have two choices.
Well, yeah. You mean you're talking
Well,
about the two-party system?
I guess the two-party system, I guess if there's someone running against the politician that did not follow through on the promises that he made, you have to get, the next person in there, I guess, from the same party
Well, you have
running
to have a
against them.
global. Well, okay, but let's say that, you know, half of the congressmen in there who did not live up to their promises got voted out next year. Don't you think the people who are coming in the next time would look at that and say, whew, okay, I got to live up to my promises now? You need to send a message. And, I mean, we're nowhere near that happening. And, you know, I mean, so Philip, do you agree that part of this is sort of people's, gee, I don't know how to put it, people being lazy and sort of resting on their laurels and not holding politicians accountable?
Absolutely. I think that in this country we've become complacent where we listen to media sound bites more than actual content.
Hmm.
And the same politicians that keep getting reelected, even though they keep breaking their promises over and over again, are simply doing so because at the time of election they have more money to spend and they have a better backing. And somehow, I hate to say it, but voters in America have become like sheep. We don't really pay attention to the politics, what they're really saying. We just go with our gut feelings and what makes us feel good at the time. And they'll throw out sign bits like, you know, can you really trust somebody without experience? Well, you know what? Sometimes we need a fresh face up there. Sometimes we need somebody with what I call intelligent ignorance. And without that, we just keep reelecting the same guys. I mean, some of these idiots serve out there for 40 years.
I know.
And had
Philip,
terrible backgrounds.
do you think that America in general has been dumbed down?
Oh, and there's no doubt in my mind.
Yeah, I mean, and
But whose fault is that? I mean,
um,
to some extent, you can't blame somebody for forcing you to dumb yourself down. I mean, part of it is, you know, parenting and how people are raised throughout the years, and different generations care in different amounts. But part of it is just, I don't care anymore. I've got my iPad, and I'm going to sit here and I'm going to play Angry Birds.
or I don't have my iPad, and my wife is working full time, and I'm working full time, and I'm so burned out and stressed out. All I want to do on the weekend is drink beer and watch sports.
But then why is voter turnout so low? I mean, if these are the people who should have the most vested interest, and you don't hear from them. Philip, do you vote?
I do.
Okay.
I do. Mostly, I wish I could say more in local elections. I do vote in local elections on occasion, but definitely in the national elections.
Yeah, and I mean, and in Oregon, we have it so simple. I'll tell you what, if you live in Oregon and you don't vote, that's disgusting to me, because it comes to our doorstep. I mean, you get out your pen, you fill it out. I mean,
Right.
these people who, you know, live in Chicago or Detroit or something, where they take the day off of work and they go stand in line for 8 hours and they vote, they deserve a medal.
Yeah.
You live in Oregon and you get your ballot in the mail and you don't fill it out.
Well, what? The local elections are hard,
I just ran.
Right.
So we just had an election last week, and I ran. I've run for 3 elections in Oregon, mostly because I felt like I shared the same concerns that Philip had with various things in this state. I ran for state representative in 2004 because I felt like this is such crap. The same people are down in Salem, and they're not doing anything different. I ran unsuccessfully. I ran the next year for school board unsuccessfully, and I ran this year in the election last week unsuccessfully again. But you know
Do you
what?
plan to run again?
You know, it really burns you out. Yes, I'm sure I will in a few years, but
Lincoln lost 8 times and he ended up freeing the slaves.
That's right.
Oh, yeah, I like to think of myself as a Lincoln. Say that again, Philip.
I was just wondering, do you spend a lot of your own money on that, or
Yeah,
do you do fundraising?
I've spent exclusively my own money in the 2004 election. I ran for state representative. I was on the Democratic ticket because there was no Democrat. It was against an incumbent Republican, and I was brand new to politics. I was 23 years old, and I just felt like, and I was running then because Hillsborough had the shortest school year in the nation that year, and my kids were starting school, and I thought, God, this is just ridiculous, absolutely sickening. What are people doing sitting in Salem arguing? We need to get this fixed. So I ran, and I did have to go to unions and go to political action committees and talk to them and try to get money from them. And I did get a few $1,000s from different organizations. And then after a few months during the campaign, I felt like I was a Democrat, and I felt like Republicans, are greedy, and they're the ones who are taking money from all these big groups, and they don't care. And then I was getting into it and realizing that Democrats are the exact same way. And I didn't feel comfortable with that money because I felt like, okay, well, I guess I'm supposed to owe this union something, or I'm supposed to owe this committee something. And so I ended up getting rid of all of that money, and I gave it away because I didn't feel like you could run a campaign like that. And but it was very uncomfortable for me. And the school board elections that I've done since then have been all my own money, paying for signs and things like that. But I mean,
Is that tax deductible?
who knows?
Oh, you don't deduct that?
I don't know. I should look into it. It
Oh,
probably
yeah.
is. I mean, I haven't spent a lot. I mean, not a ton of money, but and we're straying a little far afield from the healthcare here. But you know, transparency is the only way you're going to fix this problem, and it's beyond healthcare. It's in politics as well. Transparency, and you know what? Obama has not been very good on that.
Well, let's take a look at here's just a few things on the health care.
Now, wait, let me see if Philip, you still with us?
Yeah.
Do you have any other follow-up questions or anything?
No.
All right. Well, thanks for calling in, buddy. We appreciate it.
All right, no problem.
Thanks, Philip.
All right. Go ahead, Jim.
The Health Care Reform Act aims to benefit up to 95% of American citizens and legal residents.
Yeah, what does that mean?
There are currently 50 million uninsured and underinsured people in the country. Contributes to a growing number of deaths due to inadequate health care or lack. With the healthcare system overhaul, over 32 million Americans are expected to obtain healthcare insurance policies at rates that even low-income individuals can afford. Insurance exchanges will provide premium insurance policies, thus reducing the rate of healthcare on the long haul.
Well, and so Oregon, in fact, is sort of the pilot program for that. And we are instituting this insurance pool, and I've been researching that over the last few weeks here. That it hasn't rolled out yet. But, Governor Kitzhaber, so our governor is a doctor, which you would think makes him more concerned with healthcare. And
he's tried several times.
He has. And when he was governor before, he was governor for 2 terms, and then he left for 2 terms, and now he's back. But during his time off there, he was running a medical, I don't know what you would call it, agency, exploring healthcare options and that sort of thing. And then now he's back in office and still working on healthcare, which I appreciate. But so we are going to have this new healthcare option where they're pooling a bunch of companies together, and Oregonians can go compare costs and look at that. So I took a spin on that today.
Right, and they're obligated to accept all applicants regardless of their employment status as well as their pre-existing medical conditions.
So pre-existing conditions is a big thing,
right.
Too. And so you can go to their
Each American
website.
Is considered insurable.
Yes.
Thus giving full access to health care.
Yes, and that's that's Obamacare you're talking about.
Yeah, this is the Affordable Care Act.
Yes,
yeah.
So that was a huge step forward that people are totally glossing over.
Right.
That's a big
good.
deal.
That's good.
Absolutely. I've run into that before. I mean, the jobs that I've had have paid for my insurance, but I've almost always had to get private insurance for my wife and my kids. And so you shop around for different places, and you'll quickly find that if you admit to having certain issues, like, oh, there's a history of kidney stones here, or there's this or that, then you get a letter back saying, no, you don't qualify for this.
Right.
And that doesn't leave you with very many
United
options.
Healthcares of the world will not be able to deny coverage to people.
Right.
Okay.
But so the Oregon portion of that, you can go to the website that has information about it. It's called coveroregon.com. And they actually have a calculator on there where you can plug in. Now, this is a cost-based, or excuse me, an income-based sort of scale, okay? And while I applaud it for what it's trying to do, it really is aimed at lower-income families.
Okay.
So I don't think it's going to help you or I much. If you're middle class, not really a big impact. But you can go to the website. You can plug in, okay, what's your estimated income? How many people are in your household? And then it'll say, okay, here's what you can expect to pay under our plan. And it'll say the government's going to pay this percentage and this percentage. So I went and plugged it in for my income and my family because I was just curious what this is going to look like. And it's way more than I'm paying now. I mean,
Okay, that is a problem.
$800 a month.
For you to buy
For
health,
my family.
Okay.
Yes.
So
Which is crazy.
this is the first step. I mean, the Republican controlled House is fighting this tooth and nail. I mean, what's disgusting is the serious problems facing the country, and they cannot seem to work together anymore in Washington, while the bridges fall apart. And there are some negative points to this thing.
To what? The Affordable Care Act?
Yeah, huge cost cutting for Medicare, and this is what I was talking about. Our reimbursement for what we do for home medical equipment is being cut. So senior citizens are going to notice a huge change in the benefits and advantages that they receive from Medicare. The Medicare tax is expected to rise in the coming years. Bad news for Americans if you're, on a fixed income.
Well, let me.
Guys, I gotta admit something. I can't let this whole show go by and not admit this. I knew when I was 12 that I had to try to get wealthy because healthcare in this country sucks.
Yeah.
Yeah.
So
that's the only reason I want to make money is
so you can
take care
afford
of my family if someone gets really sick.
Right. Yeah.
Well, okay. Let me ask another healthcare related question that I found very interesting. Along with the election last week, Portland had a water fluoridation measure on the ballot. Did you follow that at all, Jim? Okay. So fluoride. So I'm from the Midwest, okay, and our water has fluoride in it back there. And when I go to the dentist out here, they can tell. When I go to a dentist for the first time, they say, "Oh, you're not from here, are you?" Because I can tell that you've had fluoride in your water. And there is sort of overwhelming scientific evidence that it is safe and beneficial to have fluoride in your water.
I think that's disputable.
You can dispute that, but you'll be disputing it with 90% of the scientists out there.
Well,
I mean, that's like saying global warming is disputable. You can dispute it, but you're going to be wrong. What's your argument, that it's poisonous?
Here's why you're wrong.
Tell me why I'm wrong, Jim.
I don't have all that information in front of me, but
Here's
fluoride.
my point. Let me make this point real quick. There's the right-wing version of this where they don't want to provide health care to everybody. And then there is a left-wing hippie version of this in Oregon, which is get your crap out of my water. Okay, I don't care if it's...
We have some of the purest water in the world, yeah. Bull Run there, yeah.
Okay, that doesn't do anything for my teeth or the teeth of low-income children around here who are not getting fluoride. Their studies have said that there are no negative effects to fluoridated water. And studies have shown that it increases dental health.
I'll have to research that more. I don't have it at the tip of my tongue.
Here's what I'll say.
Fluoride is a byproduct of the nuclear energy industry.
Dental care and health care are a little bit different. That's probably another show.
Yeah.
You think we need to have a whole show on dental care?
Yeah.
That may not be that fascinating of a show, but I disagree with that. This is a health care measure that failed because people were scared to put something in their water. And, contrary to all the science that shows that it's safe, people
there's a
decided
large
they don't want
body. There's a large body of information that says it's not.
Don't you have to go with the larger body? in my feeling, dentists want fluoridation, right?
Right.
Okay. Isn't that sort of voting against themselves? Why would they vote for that if it doesn't help their bottom line? That's making teeth healthier.
Hmm.
Now, if dentists were against fluoridation, then I'd be suspicious. I'd say, okay, well, they don't want you to get fluoride because they want you to have crappy
They
teeth.
want you to have cavities so they
Yeah.
can fill them. Yeah.
But dentists have no reason. They have no horse in that fight.
Do you go to the dentist
Horse in that
regularly,
fight.
Mike?
Yes.
Yes. Yeah.
I
Yeah,
should have
I've
said,
always
I'm a
gone.
big fan of the dentist.
I should have said horse in that race or dog
Yeah.
in that fight, but I made it horse in that fight. So I think I'm
All
going to try to use that phrase from now
That's
on.
nice.
And so that to me tells me that they're just looking out for your best interest in that case. And why would they recommend that? There's nothing in it for them other than to lose business. And if anybody knows teeth, it's dentists. So maybe we should listen to them and say, okay, yeah, maybe fluoride in the water isn't such a bad deal. But we're sort of.
How much did it lose by Mik?
It was pretty dramatic.
57 to 43 or something.
Do you think
60-40,
that's because of misinformation? 'Cause
I
that's a
think
good
it
point.
is. Well, I mean, anytime,
There was a lot of information out there.
anytime you call something a chemical, which is what they did, keep your chemicals out of our water. There's this whole notion.
Is there fluoride in Wolf Creek water, our water out here?
No,
There's not?
no,
Okay.
none of us have fluoride in Oregon, as far as I know.
I mean, you brush your teeth with fluoridated toothpaste, right?
Yeah, but it's not the same thing.
It's not?
No, it has to go into your body through some other
Okay.
means. I mean, it's not just going. It's not a physical application to your teeth. But
What do you feel
this
about...
this whole natural thing?
Uh-huh.
This is a chemical, so therefore it's bad. This is a drug, so therefore it's bad. Is crap. Now, to some extent, that's correct, but the liberals and the hippies in this state, in particular, drive me insane with that kind of
Mhm.
stuff. With the homeopaths, the naturopaths, the acupuncturists, all that has its place. Okay.
Right.
But you know what? When you've got cancer, when somebody has cancer, they're not going to the acupuncturist all of a sudden.
Right.
Then all of a sudden, oh, now you need modern science. Okay.
Right.
So don't try to tell me that science
Well,
is
there's
bad
a,
and
like you said,
technology
there's
is
a
bad.
place for naturopathic medicine, and there's a place for Western medicine.
I think
Yeah.
there is, yeah, but there's a lot of blame on Western medicine for.
Well, a lot of the diseases that Western medicine treats are the product of the lifestyle and food products that people consume.
Probably so.
Yeah. So the inflammatory.
We have Dan the dentist on air.
Oh,
Is he really a
Okay.
dentist?
Yeah, I'm a
That's what he
dentist.
said.
Okay. Oh, are you there, Dan?
I'd like to put in my input on the fluoride situation.
Okay.
In my opinion, fluoride is bad for Oregon
Okay.
and water
Why?
How come, Dan?
because it makes my job worse.
Well, yeah,
If I
because
were to make
you
mine-
want people with rotting, decaying teeth to pay for your boat payment.
Yeah.
Yeah.
I can take my family bowling every Friday night.
All right. Well,
There you go.
at least you can admit it.
Yes.
Are you really?
At Big Al.
Are you really a dentist, Dan?
Well, no.
Okay.
But I do want to make mine, though.
All right. Well, we appreciate your input, Dan.
Yeah, no problem.
All right. Have a good one.
Yeah, you too. Bye.
All right. All right. Mike, yeah.
Dan the faux dentist. I love it.
Dan the faux dent. I should have asked him
Oh.
what the name for my number 32 molar was. I should have asked him some dental specific question. I knew
That would have been brilliant.
I would have busted him right there. So we've only got about a minute and a half left in the show, Jim. Closing thoughts? What do you
Well, this
what do you want
here.
to leave our viewers with? Some nuggets of wisdom, maybe.
Eat healthy, exercise, don't smoke, alcohol in moderation.
Solid. Moderation
And,
being the key there.
Yeah, try not to, your environment and your genetic makeup will determine your longevity. So, it's hard sometimes with the stress in our lives to avoid those things that will bring out the worst aspects of our genetic makeup. So just try to be healthy.
Yeah.
Take care of yourself. Love your family. Love yourself.
Ooh, heavy stuff,
And
man.
go to the doctor regularly. Go to the dentist regularly.
want
This is Change Your Life television, folks.
this
Yeah.
is life changing right here. Let me
Okay. And go ahead, Mick, for the
let me tell people. So we've got our next show June 11th at 8 p.m. Again, we're going to be talking about bullying and parenting, sort of a very broad discussion about those topics. Check us out at WrongTvShow.com. I do want to say that it's a topic for another discussion, but I don't want to minimize mental health in this whole discussion, and we haven't really had time to even address that topic. It's going to be probably a whole show in the future, but mental health is health. It's vital. It is certainly, with shootings and the crazy stuff that goes on in this world, very important. We need to remember that. So we appreciate everybody's time. You guys have a good one. We'll see you next time on Here's Why You're Wrong.